Hello everybody, my name is Abner Obar and my final project is on poor air quality. Poor air quality is an environmental condition in which the air around us is contaminated. Now, continuing to breathe this air can lead to other health risks. Here we see a map of Bakersfield, California, and as you can see, the map is color coded. If you look to the right of the map here, you can see the color code index in which each color represents the air quality of the area. So you can have the worst being from 91 to 100. You can have good air quality from 1 to 10. You can be in ranges from 51 to 60%, depending on the area that you live. One of these air contaminants is called ozone. After ozone settles on the ground, it is classified as ground level ozone, which is part of the air that we breathe. Now, ground level ozone can lead to things like lung and throat irritation, coughing and pain when taking deep breaths, and wheezing or trouble breathing when you're exercising outside. Another one of these air pollutants is called particulate matter. Now, particulate matter is made up of little tiny pieces of solids and liquids. These pieces include things like dust, dirt, soot, smoke, and other drops of liquid that could evaporate into the air. Now, we're going to talk about some of these health inequities that do contribute to this disparity. These inequities include things like poor neighborhoods, people of low socioeconomic class, difference in race, and pollution from factories and cars. Poor air quality can also lead to some serious cardiovascular problems like heart disease, asthma, and COPD. Younger people, seniors, and people who work outside or even exercise outside a lot at a higher risk of developing some of these diseases due to air pollution. According to the CDC, 1 in 12 children between the ages of 0 and 17 have asthma. This is really bad because air pollution can trigger asthma attacks. Other inequities that do contribute to the disparity are things like lack of access to proper health care, good grocery stores, and good jobs. Some people are in dirty work environments, and some even have really poor job opportunities. Also, pre-existing health conditions and behaviors can put someone at a greater risk. I looked at the area where I stay and it is listed 80 to 85% range of air quality, which is pretty bad. Now looking at the census tract, we can see detailed information contributing to that air quality rating. Ozone is at 98% and diesel is at 96%. We mentioned both of those previously. And as you look through the census tract, there are asthma and cardiovascular ratings. Asthma is at 86 and the cardiovascular rating is at 83. Remember, we mentioned that having bad air quality can contribute to some cardiovascular problems. Scrolling down, we can also see some socioeconomic categories that can contribute to this disparity. Education, which is sitting at a 67. Now, education can affect how much money you make in the future. And we know that the number one determinant of how healthy you are is how much money you make. If you scroll down, the poverty rating in the area is at 92, the unemployment rating is at 99, and the house burden rating is at 94. House burden rating refers to homes that are very low income, but they have a high demand of things that they need for their homes. Now, looking through the census tract and some other things that we talk about, you can see that there is a direct correlation with not just the air quality, but also things like not having enough education to make enough money to become healthy, which can reduce your access to proper health care, grocery stores, and a better living condition. Some solutions to help with this disparity, I looked up on the CDC and they do have a couple of programs that could help. One of these programs include the Air Quality Flag Program, which alerts schools and communities about the air quality. There's also a AQI, which is where you can look up the air quality in your area. And you can also sign up for text alerts to let you know how the air quality changes. Another solution could be making sure that installation of air monitors should become mandatory in all buildings. Here's another map of Bakersfield showing the air monitors in the area. As you can see, there's not a lot of them, which is why I did suggest that putting or making sure that air monitors are installed in almost all buildings should be mandatory. I feel like it would help raise the awareness of this issue and also help the disparity lessen.